When I found out in 2002 I had kidney disease, my initial thought was that I was going to die because I knew nothing about kidney failure. I needed to start dialysis immediately. I traveled 3 times a week, which would have been a 2-hour drive for me there. 4-hour treatment, 2-hour drive home. And I was not well enough to do it on my own. I had to have someone with me at the beginning as I was quite sick. My family came forward and they were all willing to be tested. And my brother, closest in age to me, was a very good match. So 6 months later, I received my first transplant. And so just about a year to the day from the day I found out I had kidney failure, I had my first kidney transplant. That only lasted 1 year. I got the polyoma virus, which sits in your urinary tract, and it affected my transplanted kidney. So I was told I'd have to go back on dialysis a year later. I had to do in-center to start. I tried peritoneal to no avail. It wouldn't work for me. The catheters wouldn't work. Not sure why. Maybe scar tissue. They just wouldn't sit where they needed to sit. So then I went back to traditional in-center for a short time. And I had a perm cath, but that didn't work for long. So we tried to create a fistula in my lower left arm. Never worked. Then we created a fistula in my upper left arm. It worked for a short time. My blood pressure dropped after a treatment, and then that fistula failed. Went back to perm cath. Then we created a graft in my upper right arm, and that worked for quite some time, but I started to get blockages in it, and it so occluded off, and we went to a fistula in my lower right arm, and that's been working for about 7 to 8 years. So now we're preparing to try and create another fistula in my upper left arm. I also had a fistula in my left thigh, but it never worked. So I've had my share, and that's 20 years of dialysis from start to finish. Had my transplant in 2003. The workup took about 6 months to do. There's a lot involved, a lot of tests done, a lot of doctor's appointments. I was lucky enough that my brother was a really good match, and he also went through a lot of tests. They make sure his health is good enough that this will not affect his health in any way, that he only has 1 kidney and that all of his other aspects of health are good. With the transplant workup, it's done yearly. So if you're on a waiting list for a transplant, which I am, every year you'll be doing these tests. And it can get trying, but the benefit of having a transplant hopefully will be more than the bother of having the tests done. My transplant, the surgery went great. My brother recovered. He's healthy. He has no health issues from giving me a transplant. His health is good. The surgery went well. I recovered within 6 days. I was out of the hospital. I was home. I think I would have benefited from talking to people that have had a good transplant or people that have had failed transplant. So or even a hard transplant where you're sick or your medications are altered a lot and there's a lot of side effects and that. Because going in, I was feeling that I have a transplant, and although you feel it's a cure, it's just a treatment. It's not a cure. And I had a lot of issues with my transplant that I didn't expect, and it was really hard when I lost my transplant. So it would be nice to have both sides. And of course, we're all hopeful that it's going to work and that everything will be fine. But that's not always necessarily true, and it can be hard. It can be really hard, and physically, mentally, emotionally. And losing my transplant, it's devastating, of course, but maybe talking to someone, I would have maybe expected these things a little more, whereas I felt with a transplant, everything was going to go back to normal, and it didn't. Dealing with the emotion of losing that transplant was psychologically very, very hard. Even during the transplant, with all the side effects and the possible rejection and that the emotion and the emotion and the mental part of it is big. I felt my doctor during my transplant was, of course, very hopeful everything would turn out great, and it kind of sugar-coated it. It was, I wasn't, I was always told it was not a cure, it's a treatment, but I didn't realize how hard it could be. Mentally, it was very hard. Physically, it was very hard, but mentally, it was really hard. I felt as though if I got a transplant, life would be like it was before dialysis. And it's not. It's a treatment. It's not a cure. It's a treatment. And they did tell me that. And another thing, people get guilt when they get a good transplant. And they shouldn't. They should be thankful and happy, and we're happy for them. Or I am. Hopefully someday I'll get there too. Who knows? I think a group support for dialysis would be very beneficial to a lot of people, because I can talk to my husband, I can talk to my sister, I can talk to my daughter, and they all are very compassionate and caring about the situation, but they don't fully understand what a person goes through when they're on dialysis or leading up to kidney failure or trying to have a transplant or having a transplant. I think a group therapy or group support group would be very beneficial. Myself, I've been in situations where I just want to quit. I don't want to do it anymore. And I'm lucky enough, though I have a great support in my family and my friends, that they're my biggest support, and they can help me through it. I know patients that don't have any support and they struggle on their own.
My journey as a caregiver for Claire started when she got sick, right from day one. I was there as a support person, and it became a team. We had to become a team because it was such a heavy experience that Claire was going through, and as a caregiver, you have to be there for support, mentally, spiritually, physically at times, and it's been a long time. Being a caregiver can be very stressful at times. It's not a linear progression. There is a lot of ups and downs. There's a lot of healthy times, and times and things go good, and then all of a sudden there's a lot of down times. That always increases stress and anxiety and worry. You have to ebb and flow with everything that happens, and being there for her has been such a rewarding experience. Even so much so that I actually got into the healthcare field. It had inspired me to become a nurse.
My favorite thing about in-center was having that network of people. That was my group, you know. I got very close with a lot of them, and my nurses, they were very supportive and helpful, and travel. That's a big disadvantage, especially for a lot of people that have to travel so far for their treatments and maybe out of their culture. The shock of coming to a big center and not having the support that they're used to, be it their caregiver, be it someone who speaks their language, be it someone who is like them, just hard for them. Another disadvantage I found for in-center was the possibility of illness. I was very cautious too. If someone was sick, I didn't want to get too close, or it's just being in the hospital setting. It's always riskier for your health because there's where sick people go. Disadvantage was the ups and downs. You go in feeling rough, you have your treatment. Sometimes you feel rough leaving. That day is shot. So the next day, maybe you're feeling better. Maybe you're still feeling rough in the morning. Get feeling better. Now it's time to go back and you're feeling rough again. At home, you have your days where you do feel rough, but I'd say that's 10% of the time. 90% of the time, I do my treatment. I sleep through it. I get up. I go for my walk, maybe a bike ride, play with my grandbabies, shopping. And I don't have that dialysis hangover is what I used to call it. It's my hangover. It's dialysis. It's rough. It's hard. But this one, you don't get the hangover. Occasionally you do, but it's gentler. The big advantage of home hemo is you can eat and drink what you like. Drink, you still have to be somewhat careful, but food, fruit, vegetables, meat, dairy, you name it, you pretty much, your diet has opened right up. Like when I was doing in-center, my fluid intake was less than a liter, and because I do not pass urine at all. And my food, I didn't have a lot of fruit or vegetables, not much dairy. Now I go to the fruit truck and I load right up, and I have dairy freely, and even meat. Like there's a wild meat, you couldn't have wild meat. Now we can have, my husband's a hunter, we can have deer meat. Yeah, it's made a world of difference. When I was in center, I was on probably at least 3 to 5 more medications than I am now. And yeah, medications have decreased big time. Disadvantages to home dialysis? It's all on you. But it's not really a disadvantage. It's you get control of your life again. You get to be your own caregiver again. It is a lot of work. I won't sugarcoat it. It's on you. You got to clean your machine. You got to do your testing, do water samples. You got to make sure you have your supplies, make sure your softener's running. Yeah, it can be trying at times, especially when you're having issues with your machine. But the benefits far outweigh the disadvantages, in my mind. I haven't been in hospital for an illness in 6 years. Surgery, yes, but I haven't been sickly since I've started home dialysis. Where with in-center, I always had my hangover. I always had my day of recovery. So then you really only get half a day of normal life. I'm very vigilant on trying to keep my health, stay as healthy as I can. I eat freely, but I try to eat healthy. I exercise. I follow my doctor's orders mostly. I don't drink, I don't smoke. Have a good life, especially with home hemo. It's changed my life. Since I've been on home hemo, I've gotten 2 granddaughters, and without home hemo, I'm not sure I would have the time or the energy to enjoy them as much as I do. And for that, this is all worth it. I got to sit with my daughter in labor because I could rearrange my week. Whereas if I was in center, I would have had to call and miss a treatment and then be sick for 3 days. I did home hemo. I was supposed to do dialysis the night she had my first one. Well, I skipped treatment and I had it the next night, and I got to witness my first grandchild being born. It's pretty amazing.
Home hemo has really changed our lives. It has changed the quality of life. It allows us to be independent. It allows us to have more of a say in her care. It makes it so much easier on not only Claire but yourself. You're not always having to travel to the city for dialysis appointments. You're actually able to manage your own care in your own home, and that sense of independence really changes your life. It has become one of the best things that could ever happen in this progression of chronic kidney disease and dialysis. I can't say anything bad about it. It was very trying in the beginning. Very trying in the beginning. We went through a lot together, but again, you need to have somebody there for support, to be that caregiver for your person, and you can get through it. The payout in the end is so worth it. You got to get through the hard times, and then it'll pay off in the end.
I have used some traditional medicines, but I always let my healthcare provider know I'm using traditional medicine. And I always make sure that my source of traditional medicine is a good source that I can trust. I have tried a tea that gave me adverse side effects. And that was a long time ago in the beginning of my health journey, and I did not let my healthcare providers know I was using this tea, and I got sick from it because of there was like a sedating part in it, and it made me lethargic, and I couldn't figure out why. And anyway, I learned from that I always let my healthcare provider know I'm using it. Since I've been on home hemo, I haven't needed to use those medicines as much. As a dialysis patient, if you follow your food guidelines and your fluid intake, you're going to feel much better. And don't think I've always done that. After I lost my transplant, I went on a big pity party and I ate and drank. But I got over my pity party, and I got eating and drinking and exercising, and it makes a difference if you can do those things. Your life will be much better for it. I know it's not easy. And it's not always possible. And we always got to have our pity parties, because without them, I think we'd go crazy. But have them. Don't have the party for a month. Have a couple days and then get back on it. It's not easy. Get your supports. Ask your healthcare team, why am I doing this? Why is this happening? If you see changes in your health, let them know. Tell them. Don't give up on yourself. It's not the end of your life. It's a life sentence, but it's not the end of your life. And you can overcome it. Some advice I would give to patients when they're trying to make a decision in regards to maybe treatment or transplant, for sure, ask the questions. You may think they sound silly, but if you don't know, you need to ask. Language barriers, culture barriers, they don't ask the questions. They just assume that the best is being done for them. But I think we need an educator that is continuing that education, not just initially, but ongoing. Have connected with the family, so sometimes the family is more aware of what's happening with the health because they're not right in the situation. They're able to absorb the details better and the shock or all the information. There's so much information when you initially find out. Maybe ask to talk to somebody that's been through it. I think that is really a beneficial to talk to someone that's just another person that's been through it or going through it. I think for a lot of people that would be more beneficial than having binder facts. Because you can read that until you're blue in the face, but you don't know the emotional side of it. Because there is a lot of information you get, so many changes that are going to be happening and so many different medications and dialysis and doctors and different tests and everything. If someone can have a caregiver involved and educated as well, I think that would be so beneficial to a lot of people.
Some of the advice I would give to other caregivers, for one, is taking care of yourself and making sure, checking in with yourself if you're stressed or worried, that you're talking to somebody, that you have an outlet to manage your stress. Uh, and another thing that would be very good for caregivers is caregiver support groups. I think that is so important to have because it gives a chance for people to know that they're not alone in caregiving and that other caregivers have the same, uh, I don't, I don't want to say issues, but the same concerns that you might have and the same feelings and the same stress and anxieties, and having a group come together and talk about that and to know you're not alone. A lot of the stress relief that we do is daily walks. And for myself is getting outdoors, doing the things I love, hunting, fishing, quadding, and just being mindful of taking that break for yourself.
I think healthcare providers need to remember that we still are people first before we're dialysis patients, and that we do have families, and maybe transplant is not the option, even though your doctor thinks it's the best thing for you, or maybe peritoneal isn't going to work, but your doctor is adamant we try it. I don't know. I think they gotta healthcare providers need to remember we're people before we're patients even. We do not necessarily understand all these medical terminology, and especially at the beginning we don't have a clue what you're talking about when you're telling us how kidneys work or machine works or anything. The healthcare providers need to step back and have a real good look at the whole picture. Like, is this really a reality for this patient? Is it going to be the best for their well-being as a whole, not just for kidney disease? Where I live, there is a large First Nation population and a lot of First Nations people on dialysis. I have seen situations, elders who may speak their native tongue more so than English, who have been not deterred by healthcare, but they don't know how to communicate those questions. And I think a First Nations advocate at every in-center treatment would be very beneficial. Not somebody with a title, just somebody that they may even know that is educated about dialysis or helps them navigate travel, meals, anything like that, or just asking questions, because they may know the question in their language, but they don't know how to ask it in English. And there's not always words in their language that apply to dialysis. So they don't even know how to say some questions. So I think that would be very beneficial at every center. someone that would be accessible for elders, young people, anybody that speaks their native tongue more so than English, that can communicate to the doctors and the nurses and the healthcare team as well.
To include caregivers and include family as part of the team. They are there to support the client, and to have them included in discussions and procedures, and to make sure that they're not feeling like they're in the way, that that they're not just somebody taking up space, that they're actually there providing care to that person. So to um, include them in their care.
Don't don't give up on yourself. It's not the end of your life. It's a life sentence, but it's not the end of your life. And you can overcome it.